Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Hello, I'm Miles Hassell MD. You're listening to Walk, Don't Run to the Doctor. This is episode 19, and we're going to be talking about some recent studies on coffee and tea consumption. And we call this Coffee and Tea a Hug and a Mug because we're sort of promoting the idea that coffee and tea are pretty good for you. Many people consider coffee and tea as harmful, sort of guilty pleasures. The medical literature suggests otherwise, showing benefit for heart disease, stroke, type 2 diabetes, Parkinson's disease, dementia, cancer, and overall a lower risk of premature death in those who drink 3 to 6 cups of coffee a day. And while we're talking about coffee and tea, remember we're talking about a cup of coffee or tea that you hopefully brewed yourself with maybe a little milk in it. Not a candy bar in a cup. Not a chai latte with extra caramel. That's not coffee and tea. That's a sweetened drink and a whole different effect on your health. Many studies have been done on this since the 1960s. This study looks at 190,000 patients roughly from the UK Biobank study. And these are people who all were free of known heart disease at the baseline at the time that they're enrolled in the study. And it looked at people who were getting up to 200 or 300 milligrams of caffeine a day. That's 3 or 4 cups of coffee, maybe a bit more of that, of black tea. And looked at their risk of cardiometabolic disease. And cardiometabolic disease in this study was defined as heart disease, stroke, and type 2 diabetes. And it showed about a 40% reduction in this basket of those three conditions, what we call cardiometabolic risk, in those who had the 3 cups of coffee or black tea a day compared to those who didn't. And this is just one of many studies. If we look at the same data set, but instead of looking at their risk of developing heart disease, their risk of dying, and this study went for about 12 years, and they looked at up to 4 or 5 cups of ground coffee a day, and looked at what happens to these people in terms of heart disease. Well, they found a reduction in any cardiac arrhythmias, including atrial fibrillation, and a 10 to 20% lower risk of premature death compared to those who didn't drink caffeine. And these are pretty important numbers, especially when we see them reproducible. In that study, just to drill down a little bit more, we saw a reduction in cardiovascular disease, coronary artery disease, congestive heart failure, ischemic stroke, which is the most common cause of stroke, and all-cause cardiovascular mortality. So we were pretty encouraged by this data, and as you'll see as we talk about these, generally speaking, the data for benefit goes up to about 3 to 5 cups of coffee or its equivalent per day. And most of the data is for coffee. Some of it's for black tea and green tea. If we look just at the type 2 diabetes, which is a really interesting subset of the coffee and tea data, we see that people who have up to about 5 cups of coffee a day have somewhere around a 30% lower risk of developing type 2 diabetes to start with. In other words, they simply don't get the disease. And what's kind of interesting in terms of the thinking about the mechanisms for this is that those patients who drink coffee don't have any lower blood sugars. It doesn't have any direct effect on blood sugar. It's something else. And that could be improvements, so far anyway, the kind of things that have been shown to be associated with the effect of coffee and tea on diabetes is increasing mass of beta cells. So that's the cells in the pancreas that actually make insulin. Reduction in liver fat deposition, effects on gut health and intestinal barrier function and the microbiome. And these are all factors related to diabetes risk, but factors that don't necessarily directly affect blood sugar. So if you drink a cup of coffee, you're not going to have a significant effect on blood sugar. But if you drink cups of coffee over years, you're going to have a lower risk of developing type 2 diabetes. Within patients who have diabetes, so we're switching from people who don't have diabetes and the risk of diabetes to people who actually have diabetes and who drink coffee and tea. And we see in that group, for 2 to 4 cups of a day, somewhere around a 20 to 40% reduction in dying of any cause, lower risk of heart disease, heart attack, heart failure, stroke, and a substantially lower risk of kidney disease. The kidney disease factor is pretty important because one of the things that plagues diabetics is their long-term risk of chronic kidney failure. Once again, though, don't forget that we're talking about coffee and tea in their pure forms, not heavily sweetened. And I don't have any problem with people putting, for example, a teaspoon of sugar, 16 calories of sugar in a cup of coffee. But the more coffee you drink, the more that sugar will add up. And I definitely have a problem if it involves a lot of syrups so that it's actually a sweet drink. Don't do it. That's a candy bar in a cup. One of the other interesting things about this group of studies on diabetes, for example, is that when you looked at larger amounts, so that the more cups of coffee a day that people were drinking, the fewer patients were in that group, so the data becomes sketchier. But they didn't find any evidence of harm as you went up higher and higher and higher in doses over 5 cups a day, which is kind of reassuring. What about neuroprotective effects? So the main thing that's been looked at is Parkinson's disease, where studies for decades have shown that people who drink more coffee seem to get less Parkinson's disease. And so this is a study looking at about 180,000 people from 6 European countries, looking at their coffee consumption and their risk of Parkinson's disease. And the higher the amount of caffeine these people ingested, the lower their risk of Parkinson's disease. And so those who had the highest intake of caffeine, so think 4 to 6 cups a day, had about a 40% lower risk of developing Parkinson's disease compared to those who did not drink coffee or tea. What's additionally interesting and kind of reassuring is that those who had Parkinson's disease, who drank coffee, had slower progression of their symptoms. And these are all pretty significant for a disease that can be pretty devastating. Now, a lot of people are concerned about coffee because of high blood pressure, and that's understandable because the data are all over the place, and there's many studies that suggest a small amount of increase in blood sugar in people who drink coffee. And so one study that looked at this was a Heiberg City Health study. And those who had higher consumption of coffee in that study, that's greater than 4 cups a day, actually had lower blood pressure. Another study who looked at this, it was a meta-analysis, and showed that up to about 3 to 5 cups of coffee a day actually lowered blood pressure. Over maybe 5 or 6 cups of coffee a day, the blood pressure went up a tiny bit, about 2 millimeters of mercury systolic blood pressure, which is a small amount. So whether there's some level of coffee in you that might raise your blood pressure, it could be. However, that's a pretty high level of intake that most of us don't reach. And it's even at that level, it's modest, whereas more normal levels of caffeine intake from coffee and tea are associated with lower blood pressure. That's kind of encouraging. Is it enormously lower? No. It's not going to replace if you're taking 3 blood pressure drugs, you're probably still going to be taking 3 blood pressure drugs. But it's reassuring in terms of its overall risk for you. How about cancer? Is coffee related to cancer? The effects of coffee and tea on cancer are quite a bit weaker in terms of what we currently know. But overall, they look like they have a small degree of prevention, most strikingly with breast and colon cancers. Some of this may relate to the beneficial effect of coffee and tea on the microbiome, the friendly gut bugs that live inside you. And also there's quite a bit of evidence that tea may improve bone strength as well. So the not just colon cancer and breast cancer, but also osteoporosis appears to be favorably impacted, at least by tea and maybe by coffee. We touched on this a little bit earlier, but it's worth going back to because so many people are concerned about coffee and tea causing heart arrhythmias. Now, if you're somebody who already gets palpitations when they drink coffee or tea, you can ignore this part because there are those people that are really sensitive to caffeine. However, for the majority of people, if you drink more coffee and tea, you actually get less cardiac arrhythmias, not more, and that includes atrial fibrillation. So unless you're somebody who's particularly sensitive to those problems, then it looks like you're fine with drinking coffee and tea. Now we're going to just touch on the mechanisms by which coffee and tea may be helpful to you for your health. And the real answer is we don't know. This has been studied for decades, but the pharmacology of coffee and tea are extremely complex. There are hundreds, maybe thousands of compounds that are identified as having bioactive properties. And just take caffeine alone. Its effects includes antagonism of adenosine receptors, inhibition of phosphatidiesterase enzymes, calcium release from intercellular stores, antagonism of GABA receptors, all kinds of effects, which in turn have dozens of other effects. So actually nailing this down is not easy. Now, if we look beyond caffeine, there's all these phenolics and other compounds. You could easily identify 1,000 of them that modulate neuroinflammation and neurotoxicity, have benefits for mitochondrial function. They modulate the gut microbiota, so the friendly bugs in your gut, and this thing that we call the gut-brain axis, where how your intestinal tract talks to your brain, and vice versa. Reduction in liver fat accumulation, which is probably really significant, especially in type 2 diabetes. Reduction in gut permeability, what some people call leaky gut. Antioxidant effects, and that may relate to beneficial effects on blood lipids, such as cholesterol. And so there's hundreds and thousands of compounds involved in coffee and tea. There's a huge amount of synergism in all probability, and we're unlikely to be able to narrow down, at least in the near future, the pharmacologic effects to just a few compounds or a few simple pathways. So realize that the effect of coffee and tea appears to be significant in terms of reducing death, reducing type 2 diabetes, probably Parkinson's disease, reducing progression of Parkinson's disease, multiple beneficial effects for cardiovascular disease such as heart attack and stroke. And this relates to coffee, which has been the most studied, black tea and green tea. And when we're using the term tea, we aren't referring to herbal teas. We're referring to the classical Eastern teas, which are prepared either as green, black, or white, depending on how they're actually processed after harvesting. One of the questions that often comes up is whether these same range of benefits are seen in the decaffeinated versions of these drinks. And that's far from clear. Some of the studies suggest that the benefit is retained. Some of the studies suggest the benefits are not retained in decaffeinated versions. The discrepancies between these studies and these outcomes probably relates to whether or not caffeine or some of the other compounds in coffee and tea are related to the benefits seen. And so don't be surprised if you see lots of contradictions in the future. I'm Miles Hassell MD. I'm in internal medicine in Portland, Oregon, at St. Vincent Hospital. The website is greatmed.org. The book is Good Food, Great Medicine. The podcast that you're listening to right now is Walk, Don't Run to the Doctor.